once we do remove the soft decay, you're going to give the patient a rinse. So you're going to use air, water combined together. So you'll push both of those at the same time, the air and water. And you're going to put your HBE tip on top of the tooth, like right even with the occlusal surface. And you'll do the air and water together as that's going.
You said what on the tip?
The HBE tip should be parallel with the occlusal surface when you're doing that rinse, so that water is not going everywhere. And then after that, we're going to determine which surfaces, which if you have a treatment plan, you should already know the surfaces. So that would help you set up what we needed. So if it were like an MOD, or if it were anything with an interproximal surface, you're going to have to get out something for the interproximal surfaces. So what would we use for interproximal surfaces?
The matrix.
We could use the matrices, or we could use the matrix bands, okay, the Toffelmeyer. So you put that on there. If interproximal surfaces are included, then you need to have matrices with wedge and tension ring.
What ring?
Tension, Tension. Or your matrix band in Toffelmeyer. Or you can just put universal retainer.
Matrix with wedge and tension.
Ring. Or matrix bands, yeah. All right, so we're going to determine what we're going to use. This is where your next step as far as like your isolation is going to come into play. So if we're doing a Toffelmeyer with matrix band, then we're probably going to use another thing of cotton rolls. And if we're doing the little matrices, then we're going to use the rubber dam, okay? Once we do that, we're going to dry the area really well once we apply isolation again. We're going to dry the tooth, and then we're going to get ready to fill it. So the very first thing that you're going to do is, if it's an amalgam, so at this point I want you to draw a line, because everything up to this point is exactly the same for amalgam and composite. So draw a line, and then this is going to differentiate between the two different procedures. So amalgam. The first thing that we would do with an amalgam is we're going to need the amalgam capsules, and they're either in 1 or 2 spills, which just means how much comes in it. So you've got your amalgam capsule that you have to triturate in an amalgamator. So you guys remember what that looks like, right? It's under the cabinet in here. Now, once you triturate your amalgam, you're going to pull it out of the triturator. Okay, so you'll put it in, and there's the little pieces that snap on. Stick it in, push start. Okay, it's going to, and then when it comes out, this is your amalgam well. So you need to have an amalgam well. Just pass that around so everybody can see it.
And you transfer it to that from...
You
from
take
that
it out of the triturator, and you take the amalgam capsule and you open it up into the amalgam well. Okay? Now sometimes they have something called a membrane within those capsules, and what it does is it holds the alloy and the mercury separate from each other until it gets triturated, and it'll be like a little, it looks like a disc of plastic, and it just keeps them separate until you mix them. If it does have those membranes, then you have to take that piece of plastic out with a pair of cotton pliers before you can do anything else. So when it comes out into this amalgam well, it should be a little satin looking ball. Okay, remember we talked about properly triturated amalgam will appear as a satiny ball. So that's what it should look like. As soon as you do that, remember that we have very limited working time with amalgam because it starts to set very quickly. Very limited time. So the next thing that we're going to do is we're gonna find our amalgam carrier,
Which is
okay? And you're going to pack the amalgam carrier. Okay, so your amalgam's in here. You're gonna pack it. Let me just do this one. Okay, so your amalgam's gonna be in your little ball here. You have to make sure that your finger is underneath this little latch here, this lever, because if you do it like this, you're not gonna be able to pack anything. So you keep it under here, and quickly, while it's sitting on the table, you're gonna do just like this until it's packed. Flip it over, fill the other end, and then you're gonna pass it to the dentist with the working end. If it's on the lower, you'll pass it facing down, large end first, because this is the small end, this is the large end. If it's an upper tooth, you're gonna pass it facing up, okay? And you're just gonna pass it to the dentist, whichever tooth he's using, and they're gonna immediately put it onto the tooth, both sides if they need to. Whatever is left in here that you did not get, you have to dispose of it. We cannot use it again. Does everybody understand that? So if there's like little pieces left floating around in here, do just like that, or get the HVE. It'll catch it in the filter anyway. And then when he gives this back to you, you need to go just like this every time to make sure that there's nothing left in here. Because if there's some amalgam left in here and we put it into the autoclave on accident, number one, it's going to harden in here and it'll do like this did and it'll break. See, this doesn't have the same piece on it because it broke the plastic piece. But if you can't put it in the autoclave if it has amalgam in it, because what happens?
The mercury would get released.
The mercury vapors are released and those can be deadly. So make sure that it's out, okay? Your job as an assistant is for you to be watching while this is happening. If you know that it's a large tooth or a large filling that's going to be filled, then you need to immediately go ahead and get a second capsule and put it in the refrigerator and start it. Because as soon as he puts that in, you should be able to tell, yeah, I'm going to need another one, okay? As soon as you give him this, the next thing in your hand should be a plugger, okay? These are called plugger / condenser, either one, okay? So this is a plugger or condenser. So we've placed the amalgam into the tooth, and this, what it does is it's going to flatten it, and it's going to put it all into the tooth. The plugger. Sound like you said the booger. The plugger. So it is,
It flattens it into the teeth. Is that what you
yeah,
said?
it packs it into the areas. Okay. You may hear them refer to that as a packer.
So it has 3 names.
Well, yeah, I mean. Okay. So, as he is condensing the amalgam with the plugger, you should be looking at the tooth, and we're going to know whether or not we need to put another one in or if we're good to go. Okay? If another one is needed, then you need to immediately put it into the triturator and start it, because it's not going to take long for him to be ready for the next one, and he doesn't need to wait for him to tell you, I need another one. You can always ask, do you want another one? And he'll tell you, okay? But you should be able to look at it and know, because if it's not coming over the occlusal surface a little bit, then you need another one, okay? Because he has to have some excess so that he can carve it to the anatomy that it should be.
So you give them the plugger before you go to get extra?
Yes. So once we've done that, okay, we're going to assume that, we'll just say that we put another one in, we triturated that one, we put it in what?
Carrier.
Amalgam well. We got the amalgam out of the well with the amalgam carrier. We passed that to the dentist. Immediately when we passed that to the dentist, we got what in our hand? The plugger or condenser. As soon as he's finished with that, most of the time he's going to want something called a burnisher. Okay, and there are several types of burnishers. go back. And this is gonna be for all of them. So put it close to where you had the, crap. The low speed with the round bar. Put it with that. Sometimes they have to use, hand carving tools, like we talked about hand cutting instruments. And I need to show you guys those real quick. Sometimes it's so little of an amount that they need that they don't even use the low speed hand piece, and they'll just use something like a spoon excavator. So you need to put that, spoon excavator. EXCAVATOR. As soon as I find one, I'll show it to you. Never mind. All right, well, I'll show you guys this one first. This is a Hollenbeck.
When you get done, can you send me your video? Because I had to delete storage off my phone. So I like got 5 minutes and got like 11.
What's your number?
706-910-7239.
Alright, this is a bigger spoon excavator. Usually they're smaller than this, but they'll take this spoon excavator instead of using that low speed, and sometimes they'll use both. And this is before we ever rinse the tooth out, okay? So this is back at the beginning when we were prepping. They can use that. They can also use